Hi, everyone. Welcome to week 13 for our personality theory. This week, we are going to be looking at personality assessment, self-report inventories, and projective test. Self-report inventories and projective tests. Now, when we talk about why assess personality, now, I don't know if I've mentioned this to you, that personality assessment seeks to understand enduring pattern of thinking, feelings, and behavior. That is personality theory. We want to see a pattern of thinking, of feeling, and behavior. In clinical, organizational or pastoral settings, it helps us to clarify diagnosis, guide us to treatment plan, improvement of awareness, and prediction of behavior in specific contexts. Because as a PhD holder or as a leader in your religious organization or pastoral ministry, you'll be dealing with a lot of people. So if somebody is coming and you see a particular pattern of thinking, pattern of feeling, you will know whether you are sitting on a bomb, time bomb. And you will know how to make a referral. You will know how to take care of situation, how to manage these people. This is very important. So how do we measure something as complex and internal as personality? Because you'll be related with different personality, even among church members. So two major approaches to assessment. Personality assessment method generally fall into two broad categories. Number one is self-report measure, structured, standardized, and questionnaires. Okay, individuals report on their own traits, their own feelings, and behaviors. Self-report, that individual comes up with, their report of their own traits, their behavior, their feelings. The other one is projective measure, which is ambiguous stimuli designed to reveal unconscious process. Responses are, of course, interpreted on their own traits, are interpreted not on their own frame, not on their own, but score you get from what you administer. It's projective, standardized. So each report reflects a different theory of personality, trait-based, versus psychodynamics. They're not the same. Now, looking at self-inventories. Now, standardized tools were individuals' response to items about themselves. Typically use fixed choice formats, like Likert scale. I say choice, multiple choice, or fixed choice formats that an individual will respond to. So example is MMPI. I think I've mentioned that to you before. And neo-personality inventory. That's an example of self-report inventory. That's an example. They are reliable, they have strong validity, they are efficient and easy to administer, and norm-referenced compared to a large populations. They are norm-referenced. So their limitation is that, there is social desirability bias that is responding in a favorable way. There's lack of awareness, and there's always agreeing response sets, always agreeing, and cultural limitation in interpretation. In some culture, may not be applicable. So self-report tools are powerful to identify patterns, but they depend heavily on the honest and insight of the responder. We use this a lot in psychological settings. Okay, looking at the projective test, which is the second one, is assessment tool that present ambiguous stimuli to elicit projection of unconscious thoughts and feelings. Example of that is Rocha's in-blood test, thematic apperception test. Those are examples. We have theoretical basis. They have theoretical basis, and they are rooted in psychodynamics theory. So the idea that individual project inner conflicts into external ambiguity. Their strength is that access to unconscious material. They are rich and qualitative data. You get that from there. Useful in complex clinical cases, right? Very useful. The limitations is the lower reliability and validity, subjective interpretation to the person who interpreted it, and time intense, and cultural and examiner bias. Okay, so it's whatever they call it, that's what it is. Now, projective tests are required, always required highly trained clinicians to administer it. And it should never be used in isolation. So this is very, very important. And like we have always said, that none of the style, none of the methods is sufficient alone. Integration provides a fuller picture. So it's better to use both together. No one single method can be used. I've said this several times. No one single method can be used to assess personality. Integrative approach is always important. Some of the ethical and cultural considerations are this. Note that personality assessment must be conducted responsibly. We have always said this. And the ethical issues here is, number one, informed consent, confidentiality, appropriate use of results, and of course, you need to avoid over-interpretation of the results. It's an ethical issue. And culturally sensitive aspect is that, norm may not generalize across culture. Norms may not generalize across culture. If it is developed for the West, if you take it to Africa, it may not sound well. Language and context influence responses too. Okay, language and context. Another one is risk of misdiagnosis if culture is ignored. Human beings are the same everywhere. If you try that, you're going to get wrong assessment, wrong message to the person across. What are the applications in the clinical and pastoral settings? Now, for clinical use, we use it for diagnosis, for treatment planning, for monitoring progress, and of course, a pastoral and ministry context to understand personality differences in leadership and conflict resolution, and to get spiritual direction and formation. That is where we can use them. Assessment can aid understanding, but must never replace discernment, wisdom, relational engagement. Don't replace those things. They are very important in the ministry. Looking at the strengths and the limitation in critical evaluation, there's strength across tools. Both of them provide structure, insight, facilitate communication, support evidence-based practice. Their limitation is that there's a risk of labeling, over-reliance on text results, and human personality exceed measurements. So assessment tools are guides, not absolute truth. They are guides, not absolute truth. Okay? Let's round off. It's an overview, like I've told you, overview. Personality assessment, is most effective whenever multiple tools are combined, integrated. Results are interpreted in context. Human dignity remains central, imago Dei, because the goal is not merely to measure personality, but to understand and support the whole person, holistic person, imago Dei. We are not just want to label people, but want to understand who are we dealing with, what are we dealing with. So this is very, very important. So at the end of this week, the expectation is that you should be able to explain self-reports, inventories, and projective tests, evaluate their strengths and their weaknesses, and apply assessment principle in clinical and pastoral context. That's what we are looking at this week. If you have questions about this, please feel free to send me an email and I will provide answers to that. Please take time to listen to this and other videos which we have provided over time for all our lectures. Thank you. Take care.